Michael Hamadi, co-founder and CEO of UroRelief, and we're developing a non-invasive neuromodulation system for an at-home therapy for treating urinary incontinence and overactive bladder. And OAB is not a joke. So imagine having to go to the bathroom more than 8 times a day, waking up 3 or more times in the middle of the night to use the bathroom, and then having the sudden urge to have to urinate, and then not making it to the bathroom and then leaking yourself. This happens to 33 million Americans every year. And so basically what this is caused by is that high frequent severe urge to have to urinate and having that muscle contract and not be able to make it to the bathroom. And so it's a $66 billion economic burden to the United States, and UUIs, or urge incontinence episodes, are 2 times more prevalent in women, especially as they get into the older age, 65 years and older. And a big method right now for treatment that's been developed is posterior tibial nerve stimulation. So the sacral nerve complex that then follows the posterior tibial nerve down the leg, and then actually the arborization of that nerve in the bottom of your foot. And some technologies have targeted PTNS as a treatment therapy. So it's been well documented in literature, in some journals. And then it also has sustained benefits. So a study looking at out to 36 months and doing sustained treatments, you actually can have a reduction in urge incontinence through PTNS. And so there's been some neurostimulation technologies on the market. So Medtronic has a very invasive system, InterStim, a lot of revenue driven through that model. Uroplasty with Urgent PC, and then you have these new invasive technologies but trying to improve compliance. And where UroRelief comes in, similar to Urgent PC, as you can see here, the issue with Urgent PC right now is they got to place this microneedle, and it has to be done by a professional. So you got to see your urologist. You have to go into the clinic every week for 12 weeks, so it's really prohibitive. And so you can see this evolution of Medtronic, Urgent PC, and where we come in is an at-home therapy for PTNS by stimulating the bottom of your foot. And so we have a traditional electrical stimulator here. We use some off-the-shelf patch designs that we've developed, and a mobile app to incorporate control from a mobile app and incorporate telehealth aspects to potentially drive reimbursement as well. 30-minute treatment 3 times a week for 8 weeks. You can do it while you watch your favorite game show. And we want to make PTNS a first-line therapy and make it an at-home opportunity for patients. You don't have to go to the clinic every week. You can actually make this an at-home therapy, but we also need to be able to drive reimbursement models behind this as well. We just are in the process of completing an 11-patient study at Stanford. 8 out of 9 patients you can see here had a decrease in the number of UUI events after 8 weeks of treatment, and also had improvements in voids and urgency episodes. And then we also saw a huge improvement in the quality of life metrics. So we had clinically significant results of improved quality. And you don't have to take my word for it. So a lot of the patients were asking, can I buy the device now? They wanted to keep it. And what's interesting for us is we actually have a nice sort of massage effect. Someone gave us a 5-star rating for a foot massage. So it has a nice benefit to that. We have a very straightforward regulatory pathway. So Class 2 medical device, 510(k) as a non-implanted peripheral nerve electrical continence device, and non-significant risk has been designated by several IRBs using our technology. So looking at our timeline right now, in the last 2 weeks, we actually just signed a term sheet for rights of taking this technology for the Asia market. And we're currently raising our capital now to do our next gen development to get ready for a pivotal trial, which would be about a 98-patient trial. And we're just submitting a phase 2 SBIR to help fund that. And I think where M2D2 can come in and help too as we look to how to drive this market and a reimbursement from an at-home method and telehealth aspect. I think it's very critical to get this to the mass market, and that's something that we're looking for help with. So if anyone can help out with that, that would be greatly appreciated. So again, we're funded by a phase 1 SBIR, looking at a phase 2 to develop our next gen device. Strong IP portfolio, 11 issued patents, and a spin-out company on migraines.
Thank you, Michael. Just wanted to go back to the reimbursement question for a minute. What do you think what is your sense for what will be involved in obtaining that reimbursement with the telehealth model?
So I think for us, if we can build in this mobile health aspect of it, and I think optimizing certain treatment parameters for the patient. So we have remote monitoring capabilities, looking at efficacy, so building in the diaries into the mobile application that the urologist could review, looking at those outcomes and treatments over time, and then potentially optimizing remotely those treatment parameters, whether it be stimulation frequency and our sort of proprietary pulse patterns that they can then provide alternative treatment parameters to the patient and reviewing that data from a telehealth perspective to drive some of that reimbursement.